Hello everyone, welcome to the Voice of Nursing. My name is Adrian Tracy, CEO of ICG Medical. Today we are joined by Teresa Chinn MBE. Welcome, Teresa.
Hello.
Teresa is the founder of WeNurse and under @Agency Nurse on Twitter.
Yeah.
Teresa, welcome to the Voice of Nursing. Tell us about how you got into nursing.
How I got into nursing. I never wanted to be a nurse. It was something that I was adamant that I didn't want to do. I grew up with this photo of my grandmother on our mantelpiece at home, and she was kind of sat there as I am right now, almost kind of this kind of top half of her with a nurse's hat on and a white uniform, and she had some medicine pots on a medicines trolley behind her. Very austere looking photograph. I always used to look at that photograph and say, I never want to be a nurse. And it wasn't until I got a Saturday job in a local care home and met the most amazing nurse. She was an Irish nurse. She was just so caring and so knowledgeable. She explained kind of everything. You know, a lot of the nurses with the care assistants would just kind of, tell us to go and do something. She would tell us why, we needed to go and do something. She'd explain everything. And she was an absolute inspiration to me. And that was the reason I decided to go and do my training, really. When I was growing up, we didn't have very much money. We kind of counted our coppers to get bread at the end of the week. We kind of didn't have very much at all. So there wasn't an awful lot left open to me to kind of further my education. But nursing back then, we had bursary. So I was able to kind of take that up. And that helped me immensely. I only just got in to nursing because it turns out kind of years later I found out I had dyslexia. Of course, I struggled through an awful lot, so barely kind of passed enough GCSEs. We didn't even have to have A levels then to get into nursing. So barely passed, but got there. Which was awesome. And again, I wasn't ever really kind of outstanding at university. And when I look at some of the student nurses that I've worked with and that I've come across kind of through a lot of my social media work, I just think they're amazing. They're just absolutely outstanding. And that was never me. I kind of blended into the background. I kind of just about got through everything, but loved every moment of it. And then kind of at the end of my training got a job at King's College Hospital in London. It was on a surgical ward and I loved it. It was great. I had some of the best times ever there. But then kind of decided that London wasn't for me. So I moved to Bristol, which was halfway between, because I come from Devon, so kind of halfway between.
Okay, Dan, yeah.
Yeah, so I didn't actually kind of want to go home, but wanted to go a little bit closer. So kind of stuck a pin in the map, literally stuck a pin in the map. I went,
come out of Bristol.
I'll go to Bristol then. So I ended up working at the Bristol Royal Infirmary, and it was when I kind of then moved into a flat not far from the Bristol Royal Infirmary that I met my husband. So he lived in the flat underneath me. So I suppose if we then fast forward quite a number of years, I mum of three, working as an agency nurse because it kind of fitted in around the family and everything. And I kind of reached a stage in my career when I thought, actually, I don't think that I'm nursing to my best ability. So the agency that I worked for, their idea of CPD was to stick me in front of a video kind of once a year for a few hours. And that didn't really cut it. and I just kind of felt, moving from place to place, that the thing that I was missing was professional conversation. So my husband, who was working in social media at the time, said, you need to try and get yourself on Twitter, which is it's a bit laughable, really, because I'm missing my mobile phone. Where is it? Because here's my mobile phone. I was the last person in my friend group to get one of these. And I'm not good with technology, and people think, because of what I do, that I'm amazing with technology, but I'm not. So it was I did look at him a bit sideways and thought, well, do you even know me? But eventually let him sit me down, and he helped me to sign up to Twitter, and I had to look around, started chatting to people. And it was through one of those conversations, those informal conversations that I was having with people, that that I was chatting to somebody and said, wouldn't it be great if we could hold organised Twitter discussions? So we could say, we're talking about this on this date, and we're going to use this hashtag. Everybody turn up. So. And it was at that point when I thought, well, there's no point in wondering what if. You just got to go for it and do it. And it was entirely for my own benefit, really, because that's what I needed. I needed to be able to reach out and hold professional discussions with other nurses. So I set up a little blog. Back then, it was in the early days. We just set up a little blog, wrote a little bit of information about a discussion we were going to hold. And the first discussion was about PrEP, which I guess the nurses in the virtual room will know has been and gone now. And I still vividly remember that evening. I said to the children, could you bring down, all of your laptops, please? I think I had about 6 laptops out in the dining room. I don't know what I was going to do with them. So I had some post-it notes in case I missed anything.
Did you get any pictures?
No, we should have. I think maybe my husband might have some back,
Yeah, the first we nerd chat, whatever it is.
Yeah. So we So we got through the first tweet chat, and I just remember thinking, oh my God, if one person turns up, then that's amazing. So and we had 18 people turn up. So to my mind, that was a big win, because 18 people. Wow.
Yeah, it's great.
I'd been happy with one. So things grew and grew. So I think now we've got just over 80,000 followers, and things have changed. Yeah, I think I always remember. I'm going to go off on a tangent here a little bit, but I always remember listening to Terry Wogan on Radio 2, and he always used to refer to his listeners as just one listener. And I always feel that it's just one person, and I think that helps, so just tweeting to that one person. So it's taken off and it's worked really well, but it's also evolved. So back at the start of things, I was very reluctant to package what we were doing as anything formal or any formal sort of learning. It was really just nurses chatting, discussing things. These days that's the area that I want to push, in terms of actually we can use social media for learning and professional development, to be able to push the nursing agenda forward. And it's actually, it's about changing nurses' mindset from social media being something entirely social to to social media being something that we can have as part of our professional toolkit. So we've kind of, you know, embraced quite a lot to kind of move that forward. So things have changed quite significantly from those early days, but we still kind of have that core activity of bringing people together to discuss any sort of nursing topic, really.
I suppose that's a collaboration, haven't you? You've got the Academy of Fabulous NHS stuff run by Terry and Roy and what have you, but they're collaborating, aren't they, about best practice and about ideas and just, you know, ideas that come out. And obviously you doing that with WeNurses as well. Seems to be a lot more drive in that sort of collaboration area.
Yeah, absolutely. I mean, the thing is, it's, you know, it's a long journey, being a nurse. So, you know, and sometimes it's a really hard and difficult journey. So collaboration is absolutely key. You need kind of people to walk alongside, and I think social media allows us to do that. It allows us to kind of keep sharing the good stuff, like Terry and Roy do, but it also allows us to kind of bounce ideas off one another. It allows us to support one another. It allows that exchange of information. So you know, so having that resource of people at your fingertips as a nurse it's absolutely invaluable.
I agree. And some of the things I know you talk about is being fit to practice. That's one of your big passions. Tell us a little bit about that.
So I wrote this blog back along, and I'd like to say I wrote it to be deliberately provocative, but I didn't. I wrote it because I firmly believe that nurses do need to be fit to practice, and by fit to practice I mean we need to be fit and healthy. So, you know, fit, you know, in terms of exercising, fit in terms of eating right, fit in terms of our mental health. Nursing's really tough. It's, you know, I think we play that down an awful lot, but actually I think it's one of the toughest jobs that you can do. So not only is it physically demanding, it's mentally and emotionally draining at times. You know, that I mean, that's probably not a good advert for anybody wanting to come into nursing, but the fact of the matter is it's really hard. So we have to look after ourselves. So I wrote a blog about this, about kind of looking after ourselves, and the fact that it's in the NMC Code of Conduct, you know, that we do need to be fit to practice, and it got quite a lot of airtime, and I don't think that I expected it to kind of get as much airtime as it did. So there was an interesting statistic in that blog that 1 in 4 nurses are obese. So, and that's not just obese. That's not just overweight. That's obese. So I had a really interesting conversation with a student nurse on Twitter who said that right at the beginning of their course, one of the lecturers kind of had a conversation with the cohort that went along the lines of, well, you all look lovely now, but expect to put on at least, you know, 2 stone by the end of the course. And you just kind of think, well, okay, that's not really kind of, you know, that's not looking after ourselves. And when we work in healthcare, how can we have such a cavalier attitude towards our own health and the health of our peers? So it was interesting. You know, I got a lot of criticism writing that blog. And I take a lot of it on board. A lot of people were upset that I'd put into words that, you know, that nurses were overweight, and they kind of came back and said, well, you know, we're not supported by employers to you know, to maintain healthy lifestyles. It's really difficult because we're working shifts and all of this sort of stuff. And they were very right. That's exactly the point. Is, you know, we need to look after each other. We need, within organisations, to look after our nurses, and we need at a national level to you know, to put things out there that actually looks after this wonderful workforce. And I think that we're kind of almost missing a trick. You know, we're doing a lot in terms of recruitment and retention, but actually, you know, are we actually thinking about the health of our nurses? Because we all know that if we're healthier and we feel well looked after, then we're more likely to kind of, you know, be able to do our job, to not go off sick. So it's incredibly important. So I think writing that blog kind of, it taught me a lot personally in terms of, you know, in terms of being able to take things on the chin a little bit, you know, with a lot of the comments I got. But it's still, you know, I'd write it again if that makes sense. So I'd say it again, because actually it needs saying. Interestingly, we've held quite a few WeNurses conversations around obesity, and being fit and healthy. And when we hold conversations around obesity and being fit that are focused on patients, then nurses feel very comfortable with that. When we turn the tables and start talking about nurses being fit and healthy, then we start to feel really uncomfortable with that. So, you know, so it almost becomes this kind of elephant in the room, really, that nobody's talking about it. But actually, you know, we need to do something about it. We don't have enough nurses, so we have to look after the ones we have. And I think it's probably as simple as that, really.
That's a good point. I suppose that one thing that comes up, excuse me, here is a lot about the mental welfare of nurses, because of the amount of stress they're on. They, you know, infallible healthcare professionals have to be seen as perfect, which is just unrealistic. And, you know, we all make mistakes. But as you say, the shift pattern, the 312s or whatever they're working, you know, you see a lot of the jokes, if you like, on social media, the memes of nurses not having a break, not being able to have any lunch, go to the toilet. You know, it's kind of almost in a, you know, joking capacity, but it's actually really serious. You know, we're suffering from burnout, and that's not just in the UK, that's in the US. You know, it's a big deal.
And I think historically nurses have always kind of worn that as a badge of honour, really. You know, they've gone, oh, it was a really tough shift, you know, yesterday, and this happened and that happened, and I didn't have a chance for a cup of tea or a wee, or, you know, I didn't get my break. And actually, do you know what? It's not a badge of honour. It's actually, you know, if we don't look after ourselves properly, then how can we look after other people? So we need to really start to take our own health seriously. So and like I said, that's not just physical health, but that's also mental health. But of course, you know, we know as nurses the two are just intrinsically linked. So, you know, so if we start to look after one, then we kind of start to look after the other. So we can kind of, you know, get there. But like you said, you know, nurses facing burnout is just, it's scary. It really is. It's very scary. But I think that, you know, together we can do something about it. So, you know, we run something called Nurses Active every year, which just encourages nurses to get out through the month of August and just increase their activity. And it's interesting, so we run it in competition with the AHPs. So we AHPs is a lot smaller group than WeNurses, and every year they beat us. So I'm not quite sure what that says.
Couldn't possibly comment on that.
There's a study in there somewhere, I'm sure. But you know, we need to start looking after ourselves. We need to start to take our own health seriously, and we need to actually, you know, expect our employers and expect our national leaders to also take our health seriously. So, you know, and I think that we can start to use social media to actually kind of raise these points, to share these points, but also to support one another. When you look at things like NHS 1,000 miles. So it's just a group of people who are just aiming, and some of us don't even get to 1,000 miles. So it's just a group of people aiming to either walk, run, swim, cycle, skip, row, whatever they want to do, or a mixture of all of them, 1,000 miles within the space of a year. And it's about encouraging one another, and it's about supporting one another. So I think kind of through things like that, we can actually start to to look after nurses, and we can start to make it the norm that actually we look after nurses, we look after our colleagues, and we look after ourselves.
Oh, good point. I hope. We'll get there. You don't just do obviously the social media stuff. You do a lot of workshops and seminars with healthcare organisations. Tell us a bit about that.
Yeah. Well, I guess people started inviting me to kind of go and speak and share my knowledge about social media quite a while ago now. So I've been lucky enough to go to all sorts of events and places, and kind of in Europe too. I've kind of gone to Seville and Amsterdam and Berlin and I can't remember where else, but yeah, so which is quite exciting and quite wonderful, and that it's a great part of my role is to kind of get out there and talk to people, and you never really kind of know the impact that you're going to have. So you can kind of stand up in a room full of people and talk about social media, and especially in the early days, it was kind of like I felt like I was a bit like an alien trying to sell, some sort of weird thing, that nobody had ever heard of and didn't want, and that was really, really tricky, and still kind of to this day. Sometimes when I go to places, I think, oh God, I don't know if I even made an impact then. But one of the most wonderful things when people come up to you, perhaps at another conference, and they go, oh, I saw you at so-and-so, or you came and did a workshop at so-and-so, and do you know what? It's changed my outlook on everything. And then you kind of think, oh yeah, do you know what? It's all worth it. So it's nice to kind of share, my journey. It's nice to kind of share the value that people get from using social media, and it's nice to kind of be able just to kind of switch on those light bulbs so that people start to think about social media in a different way. Yeah. And actually they can use it as part of nursing. So we used to in the early days, people used to tweet us pictures of the little Twitter bird in a no entry sign, saying, my organisation won't let me tweet, they won't let us use social media. I think that there are still organisations out there who still kind of frown upon employees using social media, but it's changing. It's changed significantly in the 7-8 years I've been doing this, and it's still changing, which is great.
And tell us about you were a participant in the Mary Seacole Leadership Programme.
Oh gosh, yes, yeah. That was fun. So, when the NHS Leadership Academy first started all those programs, they invited me to take part in the Mary Seacole program. It was great. I had to think slightly differently because I don't have a traditional kind of leadership role, and the way that I see my leadership role is very much kind of, it dips in and out, and actually I've got no formal leadership. All the leadership kind of challenges that I take are very informal. So it's not as if I'm at the top of an organisation or anything like that. It's just really that I'm leading the way with one particular thing or another, or kind of putting myself out there and kind of championing is that word?
Yeah, close enough.
So and I found it extremely useful. It was really valuable to kind of to be in a room full of other people, We got together every so often and had these huge workshops, and they were just amazing. There was a lot of energy in the room, which was really kind of affirming, which was absolutely awesome. So I was glad I did that. It was a lot of fun. I think I passed it with a merit, which is the first ever thing I've passed with something instead of just through, which is amazing. Interestingly, it was my son who helped me. So he was going through his GCSEs at the time, and he said, "Mummy, when you write something, what you need to do is you need to follow this formula. So you have to follow point, evidence, analysis, point." And I went, "Okay." So I did. So, and it's funny how with dyslexia, if you turn kind of writing into something mathematical, it kind of made sense. So I was quite kind of pleased with myself that I managed to kind of get something that wasn't just a pass. So yeah, happy with it.
Well, I don't know. You've won a few awards from what I've got down here. You've got the Nursing Times Nursing Leaders in 2015. One of the 70 influential nurses and midwives from 1948 to 2018,
Yes.
and also the MBE in 2014. Tell us about some of those awards.
Well, I don't know what to say, really. This is the uncomfortable part of the interview, isn't
Sorry.
it? Yes, yeah. I mean, it's always lovely to be kind of nominated for awards. It's always nice to kind of get recognition for work that you're doing. But it's also always really overwhelming to kind of be up there for something. The Nursing Times Award was, I think, it was probably one of the first things that I was kind of put forward to, and to be nominated as a nursing leader is for an agency nurse who kind of spends a lot of time on social media. That's kind of it's wonderful, and to see yourself alongside kind of other names that and aspire to be like is just phenomenal. The MBE was extremely special. So it's yeah, I don't know what to say about it. Did you
go to the palace?
Yeah, well, I went to Windsor.
Okay, nice.
So, which was lovely, and it was quite an amusing day. So you have to wait in line to get your MBE, and I was in between a very old lady who could barely walk and a lady behind me who had something to do with bats. And I wondered if, and I think that the lady behind me had some health problems, so her mobility wasn't very good. And I'm stood there and I'm thinking to myself, did they purposefully put me that I had to kind of look after them a little bit? But anyway, kind of went up and got my MBE and met Prince William.
Oh, lovely.
And that was amazing. And then you can kind of, a few weeks later, in fact later that day, my husband said to me, "Oh, you were up there a long time." And I went, "Was I?" He said, "Yeah." He said everybody else was just up, got there,
having a chat
again. I said, "Oh, really?" Anyway, so a few weeks later, this video arrives in the post of me kind of my journey to going over, and it turns out that the poor Prince William, I think I chewed his ear off. So I think he asked me one question and I just kept talking. I don't think he got a word in edgeways. So we all had a good laugh about that, which was great. But yeah, it was a wonderful day, and sometimes I forget that it's there, and I have a shoebox, and I'd like to say it's not like a proper, it's a pretty shoebox.
Yeah.
So, and kind of I keep everything to kind of do with nursing in there. So kind of any badges that people give me, kind of any kind of little cards or anything, and my MBE's in there, and awards are in there and certificates, and it's just kind of, it's nice to kind of have those things, but I suppose, at the end of the day, it isn't really about getting those. It's kind of it's about what you then do. Kind of moving forward. It's not an end point. So it's actually just part of the entire journey. So to be able to get that recognition meant a great deal. But actually, we still have to keep moving. We still have to keep going. And the fact of the matter is that there are nurses out there who still don't feel supported, who still need kind of to reach out to other nurses, who are struggling with their professional development, who need to kind of connect with other nurses. So it's really kind of about just keeping moving with that and keeping it going. So although it's great to be recognised, actually the hard work never stops, and we just keep going and keep pushing things and keep pushing this agenda.
And what sort of 3 things do you see sort of coming up in the future in the nursing sort of community?
3 things. 3? Okay.
I know you could probably do 20 or 30. Top 3.
So I suppose maybe that. I mean, it's hard, isn't it? I wonder where's my crystal ball. It's I don't know if I can kind of predict the future in terms of that. I suppose that there are things that I'd like to see happen. So I'd like to see that. So when we look at Ofcom figures, we look at that actually about half of the UK population are using social media to some extent or another. So I'd like to see kind of half of the nursing population using social media to connect, to share, to work with the people they care for, to support one another. That's kind of what I'd like to see. So it's about kind of getting nurses using social media in a safe and responsible way, but actually just again, I mentioned it before, it's just turning on those light bulbs to say that actually we can use this as a professional tool. So I suppose that's one thing that I'd want to see. The other thing that I suppose goes alongside that is actually using social media in a professional way. So when I say that, I mean that in terms of being digitally professional. So a lot of us have the skills to be able to use social media, and in fact, when I look at my kids, it's like that's the way that they communicate. But we don't necessarily kind of think in a digitally professional way. So you can, when you look at on the NMC website and you search social media or Facebook, there's a lot of fitness to practice cases that come up in regard to that. So I actually think that we need to start thinking about ensuring that our student nurses coming through have the skills to be able to be in this space. So that they think from day one in terms of digital professionalism, and that they behave appropriately.
Is that trained as part of the degree or anything like that, or trained in any of the associate roles or anything?
No, it's not currently, but we've been running a pilot program with Plymouth University. So the Plymouth University have had the punks. So anybody on Twitter, if you see them, and they've got PUNC, which stands for Plymouth University Nursing Cohort, kind of in their Twitter handle anywhere.
Yeah, okay.
Then they're part of the punk program. So they've been doing that for quite a number of years now. And then last year we actually set up a social learning program with the new cohort of students, and put them through a month's worth of our WeLearn platform that looked at digital professionalism, and actually got them to learn about digital professionalism whilst introducing them to using Twitter and tweet chats, and also things like YouTube videos. And I think we had a slight look at Facebook. We had a look at podcasts and infographics and blogs and all of those sorts of things. So we kind of taught them about digital professionalism by using social media.
Right.
And it went really well. We had some amazing feedback. We're due to do it again this year. So we're just in talks at the moment about it. And yeah, I think it's something that I know that we're all keen to kind of have as a gold standard in terms of, you know, nursing students, that actually they're exposed to social media in a safe way, and they, from day one, they learn how to use it professionally, because Lord knows we don't have to teach them how to use it physically. You know, they're on there, they're in it. And you know, when I went and spoke to all the students at Plymouth University at the very start of the social learning course, you know, before I'd even finished saying the word Twitter, you know, half of them had already signed up. So you know, it's just it's a very, very different generation. They don't need to be talked through, you know, the whys and wherefores of how to use social media. But what they do need to have is that that learning around digital professionalism and how to behave as a professional within this space.
I suppose a nurse has got that trusted brand, doesn't it? In all the reports, you always see nurse is number one as the most trusted profession. You want to keep that, even with the social media age, you know, coming across. You don't want to change that perception.
Yeah, absolutely. And I think that, you know, and I suppose that brings me to, we said 3 things, didn't we? So that probably brings me to my 3rd thing. We haven't rehearsed this.
Not at all. Live.
So that probably brings me to my 3rd thing in terms of, you know, of social media. And I think that, you know, and this is probably a bit pie in the sky, or a lot of people might think that it is. But I actually think that we need to start thinking in terms of using social media with the people that we care for. So again, when, you know, I talk about my children a lot, but when I look at my children, you know, social media is their primary form of communication. So, you know, and I was always taught in nursing that we must communicate with people in the way that they wish to be communicated with. So, you know, and that may be it. In years gone by, that may have been, you know, calling somebody Mrs. Smith rather than Jane, but actually, you know, here and now today, it's actually about, you know, using social media to communicate with them, because that's how they're communicating. There are a lot of hoops that we have to jump through in order to get to that stage, and you know, cleverer people than me will be able to kind of work out what those hoops are, and you know, hopefully kind of, you know, start to mitigate some of them. But I'm really confident that we'll get there, because I think that, you know, my children's generation will start to demand that. So I was in the car with my son one afternoon, and he said, "Oh, I need to make an appointment to go and see the doctor." And I said, "Okay, you'll need to give them a call in the morning." And he said, "Well, can't I just text them now?" It's like, "No, you've got to call them first thing in the morning." And he said, "Well, I'll just call them now." And I said, No. It doesn't work that way. You have to call them in the morning.
You've got a good point.
Good point. So, you know, why couldn't he text them and make an appointment? Why couldn't he WhatsApp them? You know, why couldn't he, you know, why did he even have to go to the doctor? Why couldn't he just Skype them? You know, we're getting there with these things. It's, you know, there are pockets of really amazing practice, but you know, I'm hoping there'll be a day, you know, when actually, you know, we kind of get to tick, actually, you know, I want to be able to direct message on Twitter my doctor, because that's how I communicate. So why can't I? So, you know, but it's going to take us a while to get there. I do kind of I take a lot of comfort in the in history. So the history of the telephone is one that I talk about quite a lot. So when we look at the history of the telephone, when it was first invented, people said it would never catch on. So because, you know, messenger boys, that's it. That's, you know, that's the way that it works. That's the way the world works. So they couldn't actually see that the telephone would catch on. And two of the main concerns around the telephone were around privacy. So the first one was that you had to go through an operator to make a telephone call, and they could listen into your phone call. The other privacy issue was that telephones were placed in quite public areas. So anybody who was stood around you could listen to your phone call. Well, both of those things have since been resolved. So if we look kind of, you know, however many years later, here we are. And actually, you know, I was on a train the other day and at least 6 people made a phone call in front of me via their mobile phones. So we've adapted and changed. And we've also got rid of the telephone operator. So they're no longer there. So technology has moved on and changed. So when you look at that, then you can actually start to have a lot of hope for the future, that actually, you know, my son who wants to be able to WhatsApp his doctor for an appointment, it's going to happen. It's you know, we're gonna get there. But I suppose we just have to have an open mind, and we just have to be open to the possibilities. But I think you know, that it will get pushed through, because people will start to, you know, I haven't got time to be phoning people.
Yeah, all hanging on hold.
No, that's even worse, isn't it?
And if you think back, looking back at the beginning of your career now in nursing and where you've got to, is there any advice you'd have given yourself now looking back? If you're sitting down and chatting to your younger self going into that diploma?
Yes, yeah. I think the biggest piece of advice I would have given to myself was to be braver. So I know I'm not the bravest of people, and I probably still do. In fact, I know I still do. I'll just sit on the sidelines and watch, and I'm quite happy to sit on the sidelines and watch. But sometimes you kind of need to step forward and you need to speak up. And I think it takes courage to do that. And I'm not quite sure where you find that courage from. Sometimes it's about just, you know, giving yourself a talking to, isn't it? And sometimes it's about other people giving you a push. But yeah, I think it would be braver.
Fair enough. And just sort of rounding things off, is anything, you know, outside of work? I know you have a few hobbies. Running, especially. Running keeps coming up. I've been told to ask you about running.
Running and baking, I suppose.
Hopefully not at the same time.
I run so that I can bake. So,
right.
Well, not so much so I can bake, so I can eat what I bake.
I was going to say 5k equals a certain amount of cake and things like that.
Yeah, I kind of sat here, so I can see that there's a cake over there.
Very nice, very nice. And what message would you like to give our nurses and, you know, people who watch this? Is any message you'd like to pass on to them?
Yes, use social media. Start to think about it differently. Don't just use it to moan about this, that, and the other. Start to use it, and I'm kind of looking at you on the screen there. Start to use your voice in social media. So, you know, start to kind of say things. You know, a lot of people say that, you know, they're wary about kind of poking their heads above the parapet, but it's all too often it's not about what you say, it's about how you say it. So, you know, so don't think I won't say that. Think, how am I going to say that? And start to use social media to show that nurses do have a voice. Start to raise issues, start to ask questions, start to be curious. Use social media for your professional development. Get out there. Use the tool that's there. It's at our fingertips. There's a world's worth of nursing knowledge out there in this virtual space. How could you not?
Sounds good. Teresa, thank you so much for your time. Thank you to all our nurses, allied health professionals, doctors and carers for looking after us all. Thank you for watching The Voice of Nursing. We'll catch up with you again soon.